Hey, Sherry.
How you doing?
I'm fine. What about you?
Doing good, doing pretty good.
Well, good. Have you been doing this week?
Doing good. Just trying to stay busy, trying to get things, in order in my house so that maybe if I do have the chance to start doing something, I won't be overwhelmed.
Right.
Since it's been a while, so
Right.
trying to get all that stuff in, kind of together.
Kind of doing some spring cleaning.
Exactly, exactly.
All right. That sounds good. Today what I want to do is we'll work on setting some goals for you that we need to work on, some issues and things that you may feel like we need to address. I want to go back over last week. Remember the confidentiality statement that I had you to sign?
Right.
You got any questions about that?
Mm-hmm.
Okay. Well, I want you to just feel free to say whatever you want to say that comes to your mind, talk about how you're feeling and what you're thinking.
Okay.
That's good, because it's not going to go anywhere. It's just between me and you.
Okay, good, good.
So, how have you been with your taking your medicines and you're still taking chemo, or you're through with chemo?
I'm through with chemo, but I'm taking the tamoxifen, which is you take it for a period of time after usually up to 5 years, but now they're actually expanding it to 10 years now. If you're considered a high risk, which of course I am. I don't know why, but I am. But I take the tamoxifen and I take an Ultram, which is a pain medication that, because the tamoxifen causes bone pain, and that seems to help that area. But I also still deal with the narcolepsy, and it seems that sometimes it's worse than other times. And so I take the medicine for that, which is the Nuvigil and Adderall, which I've been concerned about that because I hear a lot of negative stuff about, because it's an amphetamine according to the bottle, and I'm worried that would keep me from getting a job because I've heard a lot about it.
Okay.
So, but I take it when I need it. It's not necessarily something you do every day.
Right. How often do you get real tired and have episodes with the narcolepsy?
Usually, up until recently, I would have maybe 1, maybe 2 episodes. But here recently, it seems to be kind of a little bit more. But I think I'm kind of trying to follow up with my the sleep doctor and trying to get my CPAP bumped up a little bit if it needs that, because there's things that can be done. Plus they've put me on a B12 injection once a month now. They said it takes a little time for that to kind of build up, because they said I was really, really bad with that, and something else, iron. I was very low in iron, so they gave me iron injections too.
Okay. Does that seem to help you
Yeah.
after you get them?
Oh yeah, it makes a difference in the world. I didn't realize how, I guess I do stay anemic. I don't know why, but I do. But they say that sometimes is a side effect of the chemo also.
Okay. Okay. All right.
So, but basically I'm working with my doctor to try to get that under control.
Well, that's good. That's good. Your medicines that you take, you said one of them was considered
Amphetamine.
When you look for jobs, employers sometimes, not all of them, but sometimes some of them require you to take drug testing.
And I can understand that. There's a lot of mess going on. I mean, it's just crazy.
Right.
But what would I do? I mean, do they let you explain if you're prescribed something? I mean, what do I do with that?
I know some of our clients sometimes that we send for drug testing, the place where we send them to will ask the client And,
Are you prescribed anything?
Right, right. And then they want to talk to the doctor
Oh, okay.
too. And so they will call the doctor. But I feel like in your case, if we could get a note from the doctor,
Mm-hmm.
that maybe, they will accept that and understand why you're taking this medicine and how it makes you do.
Right.
You know, falling asleep, the
Right.
symptoms and things that you have
Right.
too.
Oh, I'm sure he would have no problem doing that, because he's mentioned that before, you know, if at any time, you know, I need, because he and I had talked a little bit about that, and he was like, you know, that he has had patients where they were drug tested and whatever medications that they may have been on, you know, he had to justify why they were on it. So.
Right, okay. Well, that's good, that's good. I'm glad that he will do that for
Oh, yeah.
us.
Mhm.
Do you have good support with your family?
Yeah, they're very, you know, I told them what I wanted to do, and, you know, there's concerns, but nothing that's, you know, they're all in support, you know, but they also know that there's a lot that I'll be dealing with, and they want to make sure that, you know, that I'm okay.
Right.
But I don't think that's going to be a problem, to be honest with you. I really don't. So.
And you prefer daytime?
Yeah, actually, it's, anytime, actually. Now, because of the way my sleep issues are, there's times that I'm wide awake in the middle of the night, so, you know, my kids are older, so I don't really necessarily have to, I'm not tied to that, so to speak, so.
Okay.
Anytime's actually okay.
Okay, well, that's good.
Mhm.
Okay, we talked about doing some testing.
Mhm.
I looked at, your paperwork that you submitted, and, you have a lot of good skills from previous jobs
Mhm.
that you've had in the
Mhm.
past. And, but you've been through all this chemo and you're taking all these medicines and everything, and sometimes that can play a big role in your memory,
Oh,
and
yeah.
sometimes,
Oh, it plays a huge role. It's, and then that concerns me. I don't want to, be a problem for a potential employer. You know, it's like, you know, I don't want, I've always been the type that when I'm working, I give 200%, and I don't want to all of a sudden, once get there and find out I can't do it, and then,
Right,
you know,
right.
leave them high and dry. I don't do that. I've always had I've never been fired from a job. I've always left in good standing. My mother always told me, don't do that. Whatever you do, don't burn your bridges.
Yes, that's very good. That's
Mhm.
very good. That's what we want.
Yeah, and then, because you never know when you're gonna need them, because
Right.
I wouldn't mind going back, especially when I did cashier work for Walmart. I wouldn't mind going back, because I really enjoyed it. It was, they're very toothy about when you take breaks. I mean, you'd be working, and then all of a sudden, boom, it's time to take a break, and you're like, I just got here, it seems like, but
Right.
you know. So I wouldn't mind going back to them at all, really, I really wouldn't.
Okay.
I'd also had seen where somebody was looking for an activity assistant in a nursing home, wouldn't mind that. That would at least keep me busy,
Right.
because I don't need to be sitting still, because that's a bad thing for me. Because I will fall asleep. I don't want, I mean, that's part of that narcolepsy,
Right.
even with medicine. It'll do
Okay, all right. Have you looked online for any jobs?
it. Well, I don't have a computer at home, so I haven't been able to do that.
Okay, well, what about going to the Wind Job Center?
Well, it's been a while. I went back before Christmas, which several months ago, but they didn't really have anything, and so I really hadn't been back. And that's why I was talking to a friend of mine. They told me about vocational rehab and ability works and stuff, and I said, well, that may be my best bet, because I don't know
Right.
what I can and cannot do,
Right.
really, truly, when it comes down to it, you know.
We do have a lot of contacts with employers outside, and I do know the director of the Wind Job Center. He's a good friend of mine, and so, if you would like, I could get in contact with him, or we can go up there together and, talk to him, and they have computers that, we can get onto and see what jobs are available
That'd be good, yeah.
too. And Walmart also has a where you put in an application online, and you can also use the computer to go online and put your application in for Walmart
okay.
too.
That's good. Okay, that's good.
Okay? Well, we'll work on that and, discuss that and see what we can do about that. Also, I'll get you set up for some testing this next week and call you and let you know. And we'll look at the results of that and see what your strengths are, what your weaknesses are, and try to work on those issues too, and how we're gonna compensate for that.
Right.
If we have to make any kind of accommodations or anything like that, so.
Okay.
And if anything new comes up, that, I need to know about, that we need to discuss, let me know, and, we'll do that.
I'll also talk to my doctor about doing a letter,
Okay?
to be able to have that just in case it's needed.
Right.
Because I don't mind anybody knowing if there's a problem, it doesn't bother me.
Right, okay. Well, that sounds good. And I'll look into some other things for us. So you be thinking about some other job leads that you might be interested in case some of these others that you mentioned don't work out.
I'll have a plan.
Okay, well, I appreciate you coming in. Any questions or any concerns or anything that you have?
How will you let me know about the test?
I will call you, and, are you at home most of the time? I will call you and let you know what day you've got set up, or if that's a convenient time to come in. And then we'll do it before your next session next week. Okay, well, that sounds good. All right, well, thank you.
Thank you.
See you later. Okay.